Hi, welcome to the 30-day Tai Chi Inspired Better Balance Sitting Challenge. My name is Elizabeth and I'm excited you're here ready to take on this challenge. Now before we get started, I'd like to introduce you to three of your new friends. On the right side of me we have Buddy, who is a Labradoodle. On the left we have Tulip, who is a Wheaten Terrier. And then here we have Clark, who is a Yorkie. Now, Buddy is the brains, Tulip is the beauty, and Clark, he's the boss. As for me, like I said, my name is Elizabeth. My credentials are included in the introductory video, but I am an occupational therapist. My other certifications are listed there. Now, as for right here, the purpose of this video is to discuss this challenge and what we're going to focus on. Now, the title of this challenge is Tai Chi Inspired because we're going to use the components of Tai Chi, some of the components, and integrate them with that therapy approach. Now, the four areas that we are really going to target is pulmonary rehabilitation, so some lung strengthening, postural retraining, specifically focusing on scapular stabilization, and sitting balance, specifically focusing on uptraining the proprioceptive system. So let's talk about those real quick. Lung strengthening, pulmonary rehabilitation. Tai Chi has been shown to be just as effective as a pulmonary rehabilitation program. And one of the reasons for that being so effective is Tai Chi's focus on strengthening the diaphragm. Now, the diaphragm is the largest muscle that you use for respiration, for breathing. It's a dome-shaped muscle that sits underneath your lungs and heart. And when you inhale, that dome lowers down and you take in your oxygen. And then when you exhale, that dome recoils back up and you expel your carbon dioxide. Now, being that's the biggest muscle that you use for breathing, Tai Chi focuses on strengthening it and stretching it because we want it to move in its full range of motion to really get some good lung expansion. So the moves that we're doing are really going to focus on stretching out that diaphragm in all directions. And then we focus on strengthening throughout something called three-dimensional breathing, which I will teach you. And another way we focus on strengthening is challenging that diaphragm to do multiple roles at the same time. Because while the diaphragm is there for your breathing, about 70% of it is used for respiration, but about 30% is used for posture. And since we are going to challenge the diaphragm to do both of those at the same time, we're really targeting its strength. So that's what we're focusing on with our pulmonary rehabilitation approach utilizing Tai Chi. Now, the second area that we're going to focus a lot on is postural retraining. As we age, the muscles in front tend to get tight and pull us in. And this is because the muscles in back get very weak and long, and we find ourselves in this position. And the problem with this position is, well, there's multiple things. First off, our head is about 8 to 10 pounds. So think about all of that strain on your neck muscles. That can create a lot of pain. Now think about what's happening to your chest cavity when you're falling over. Your lungs just don't have the room to expand. Then also think about your back. How are the curves changing when you're in this position? Also, think about your balance. Now, if you're curled over like that, that changes your whole center of gravity, especially in standing. So those are some of the negative influences of having that bent over posture that all of us develop even as a younger age. But we can fight that, right? So these exercises and Tai Chi utilizes the approach of strengthening the back and opening the front. And that is what we're focusing a lot on. Now, in alignment with that, we're targeting scapular stabilization. Now, the scapula is this that shoulder blade in back. And when it gets weak, it tends to fall away from the spine and tilt down. hence why we're in this position, right? Now, we absolutely need that scapula to pull us back for our posture, but we also need it to stabilize our shoulder because the humerus sits like a ball inside of a socket, and that socket is the scapula, and they absolutely have to work together. On average, for every 2 degrees of movement that you have at your humerus, you have about 1 degree of movement at the scapula. They cannot work independently and have to work together. I have a whole video on scapular stabilization to explain this a little bit further and give you a reminder of why we're focusing so much on it. Now, in order to work on postural retraining, another emphasis that we're doing is big movements. Now, this is not a component of Tai Chi in the aspect of the hand movements that we're using. Tai Chi is very soft and relaxing, very flowing. Phenomenal, nothing wrong with that approach. But we have a unique approach in that we're incorporating big. Now, big comes from an LSVT BIG technique, which is for Parkinson's, but I have experienced to be extremely effective for all populations. And one of the reasons we're doing big is that when I encourage you to lengthen your fingers, I'm also going to encourage you to lengthen your arms. And what I mean by that is we're going to take that arm and reach and lengthen it so that we are now engaging our scapula and back. So that is the reason why things are going to be big and long, as well as to open everything up. So that's something that makes this a little bit more unique. Now, the next area that we're going to focus on is sitting balance. In Tai Chi, this is a component of Tai Chi where things are very slow. And things are slow so that you hold that position, and now your muscles are sustaining a contraction. Instead of just a simple 1, 2, now we're going to be holding that, so your muscles have to stabilize your center of gravity the entire way through. A second system that has to do with balance is called the proprioceptive system. Now, proprioceptive system, your proprioceptive system, is the system that tells your brain where you are in space. So it'll tell you, hey, you're leaning over, you're bending down, you're shifting to the left, you're shifting to the right. As we age, this system can decline, but it can be responsive to exercise. And that is what we're focusing on, is going slow to increase that awareness in that system of where you are in space. So Tai Chi has been shown to be extremely effective for uptraining the proprioceptive system. Now, as you can tell, I'm big on education because I'm big on people understanding why they're doing what they're doing. And so that's the reason why alongside of these exercises, there are supplemental videos. And these videos are going to remind you and teach you about why we're focusing on the scapula. You'll find out that we're going to be doing a lot of glutes, which are the 3 muscles. It's the nickname for the butt muscles. We're targeting those a lot. Why? I'll talk about how those are a huge component of posture and absolutely need to stabilize the lower body. So that's important as well. Like I said, we're going to talk a little bit about breathing. Why are we doing this 3-dimensional breathing thing? A reminder of why are we going big? Those are some great videos I highly recommend that you watch. Now, there are other supplemental videos that have tips for individuals with Parkinson's, tips for COPD, tips for MS, and tips for arthritis. There's also a tip video for urinary incontinence as well. Now, while these are special areas that you should consult with your physician, I'm just sharing some tips that have been very helpful for my experience and the people that I have worked with. Now, that being said, all of these exercises, this whole video, you really should make sure that you're in alignment with what your physician recommends or prescribes. Everything here is not meant to replace your personal medical advice provided by your physician. So please don't do that. Also, please don't neglect seeking treatment for something because you're treating it here. Please don't do that. So all that being said, another thing I do need to make sure is I don't believe in no pain, no gain. So if you're experiencing pain in any way, please don't do that exercise. Avoid it. If you're experiencing joint pain, or especially if you've just had a surgery, please consult with your physician first, especially anything that has to do with heart surgery, because we're opening up the chest and your doctor probably does not want you to do that. So please, after any surgery procedures, please consult with your physician before jumping in to an exercise program on your own. Now, real quick, before we actually move into our exercises, that actually kind of gives you an introduction of what this program is and what we're going to target. There's also the supplemental videos as reminders while we go. Right here, before we jump in, I'm going to talk about three-dimensional breathing because it is one of the things we are going to focus on. Now, as I mentioned a little bit earlier, Tai Chi has been shown to be extremely effective for lung strengthening because of its focus on the diaphragm. That diaphragm is that dome-shaped muscle that we just talked about is your main muscle for respiration. There are other muscles that are supplementary, most definitely, and we work on stretching those out. There's some of them between the ribs called the intercostals. If those are tight, our ribs can't expand, right? So we're targeting other respiratory muscles as well, but this is the main one. Now that diaphragm, like I said, as you inhale, it lowers down, and as you exhale, it recoils back up. Now it makes sense that you want your diaphragm to lower and recoil in its full range of motion, all the way down and all the way up, right? So that you can get all of the oxygen in and, very importantly, all of the carbon dioxide out. So to do this, we are going to be breathing in through the nose, out through the mouth. If I catch my residents or patients breathing in through their mouth, what happens is I catch them leaning over because then the tongue isn't in the way. And so now they're doing mouth breathing and they're not getting the same amount of oxygen. So shoulders are back, good posture, right? That way our lungs can expand. In through the nose like you're smelling a rose or a flower. Now, out through the mouth with pursed lips like you're blowing out a candle. And as a reminder, there's a video that's shorter to remind you of this. If this sounds like a lot in one video, there's little videos that you can watch for little reminders. So just a side note. Now, when we breathe in through our nose, we do want to breathe down. Why? Because you want that diaphragm to lower, right? So we breathe in and we lower the diaphragm, which means you want to see your stomach stick out. That's a good thing. You're blowing up the balloon because the diaphragm is lowering. Now, what's the difference between this and something called diaphragmatic breathing? They're very similar, except here we remember that the diaphragm's a dome, and when you flatten it, you can flatten it in all directions, not just forward, back, but to the side and to the back. And that's where it's kind of three-dimensional. Now, when you're done lowering, which we want to lower all the way, then we exhale and it recoils. Now, this is extremely important because when we exhale, we want to expel almost all the carbon dioxide. There will always be a little reserve, that's normal, but we don't want to trap too much carbon dioxide behind. Why? Okay, if you have all this carbon dioxide left behind in your lungs, the diaphragm doesn't recoil all the way back up. And what happens if your diaphragm doesn't recoil back up? It flattens down. It doesn't have that full range of motion. And what happens when a muscle flattens or doesn't move through its range of motion? It shortens the muscle fibers. And now you're not getting that full range of motion or the amount of contractile force, the strength behind it. So your diaphragm becomes shortened weakens and contracted, as can happen. And this is what can happen for individuals that have emphysema, which is a subtype of COPD. And that is why I created a video just for you. So if you have one of those respiratory illnesses, please take the time to watch that video. Now, when we exhale, remember we want that pursed lip blowing out the candle, recoil that diaphragm back up. And that is what three-dimensional breathing is. Breathing in and down, not on our chest, not at our neck or our shoulders, but breathing all the way down and recoiling all the way back up. Strengthening that diaphragm, stretching it out, opening up the chest to allow our lungs to expand. That is a lot of information right there. So, all that being said, please watch the supplemental videos, which are shorter, because then you can re-watch them if you need to, instead of this whole long video that has all of these explanations in one spot. I hope that you found this insightful, especially as to why we're doing everything we're doing in this challenge and the things that we're targeting. So, all that being said, I think we're good to go. I'm so excited you're here. Let's jump on in and please join along.